Insomnia and sleeplessness. This is a big problem for a lot of people. And so let's talk about it. What can actually be done about this? What works? What can improve your sleep quality, help you to fall asleep? Um, and what can actually cause this problem? Now, keep in mind that insomnia is an actual diagnosis that has to be made by a healthcare professional. So let's talk about sleeplessness in general, as well as insomnia, and a few remedies. Now, keep in mind there's certain things that can prevent you from falling asleep: stress, anxiety, tension, just mental tension, and then consumption of stimulants, caffeine, and energy drinks, and anything that you're taking to get you to work. Cocaine. Uh, I'm joking. Don't take that. Don't don't do it. Um, but basically, stimulants are going to help, going to force you to stay awake. They're not gonna allow you to sleep that easily. Of course, when the crash comes, then you'll sleep. Yeah, you'll sleep really well then. Uh, so if these are some of the things that you are doing, if you're taking stimulants, if you are stressed out, if you're having anxiety, avoid the stimulants firstly. Or if you have to take caffeine, if you have to take energy drinks, take it away from your sleep time, like long before. And if you're struggling with anxiety, I've done a video on anxiety. I've also done a really detailed article on my website on anxiety and things that can help you for that. And even stress, there are things, the things that I mentioned in the article for anxiety also help for stress. Now, of course, it's easier for me to say, it's easier said than done when I say to get your stress under control. But when it comes to a physiological aspect, the way stress affects your body, there are things that can be done. So let's talk about remedies now. What can be done to get you sleeping? Number one on this list, of course, everybody knows about melatonin, right? Melatonin is the go-to. But melatonin doesn't work for everybody. And I'm not a big fan of melatonin. So let's talk about three things that I am a fan of that I know work that are validated in clinical trials. Number one on this list is chamomile. Chamomile is one of my favorites. It's a sedative herb that it's usually taken as a tea. And chamomile tea has become it's a very common remedy now for sleeplessness. And it can be purchased at almost any grocery store. And you can use 1 to 2 cups of this. Sometimes what I personally do, I honestly sleep like a log most days. But when I don't, I take 2 tea bags of chamomile tea. I like to use, there's a very specific brand. I'll post a link to the one that I use in the description. And this puts me to sleep. This works. And in clinical studies, chamomile has significantly improved sleep quality. So chamomile is a great option. You can look into that. Next on this list is valerian. Now, valerian is an Ayurvedic herb that's actually quite well known for helping people fall asleep. It's also used for treating other conditions like restless leg syndrome. And it's a potent sleep-inducing herb that it's also known as Tagara, or that's spelled Tagara in Ayurvedic literature, if you want to go and look this up. And it's used for a wide range of neurological conditions. Now, in multiple clinical studies, valerian has significantly improved sleep structure as well as sleep perception. And this is one of the main things that I use with people who come to me with Parkinson's. And the reason why is the connection between valerian and restless leg syndrome and the pathophysiology of restless leg syndrome in relation to dopamine. So if you are somebody who struggles with that condition, Parkinson's, this is what I usually advise people to use. And always, please, for the love of God, use this under the proper supervision, because these things can interact with other medications. So be careful. Make sure you speak to your doctor about it, let them know, and ask them if this is safe for you given whatever else you're taking. Also, if you're taking 100 million other supplements and you start taking these things and you find that it doesn't work for you, you have to ask yourself this. Do you know which of these things interact with each other or block the effects of each other? If you don't, you probably want to speak to a professional. So next on this list is magnesium. Now, magnesium is well known for its ability as a muscle relaxant. It's also an anti-hypertensive and anti-diabetic mineral. It's both a mineral and an electrolyte, and it plays a role in many things. I think there's about, what is it, 600 different physiological functions, and one of which is nerve conductivity and the formation of neurotransmitters. Those are the chemical messengers in the brain, and so this mineral is able to help you relax. It calms the body down, it relaxes everything, and it's been proven to be highly effective in treating insomnia in clinical trials. It's also useful in treating anxiety. So, and if you have any neurological conditions where you have like spasticity, this magnesium has also been found to be beneficial in treating spasticity. So these are my three top sleep-inducing remedies. The reason why I'm sticking to these three is because this is an evidence-based channel. I like to give evidence-based remedies. But there are other general remedies as well, home remedies that actually do work, like consuming a handful of almonds at night. That can help you to fall asleep. The one thing that I've noticed that really works well is cocoa. Consuming something that's rich in cocoa. That's because cocoa actually increases cerebral blood flow, and that helps you to fall asleep as well. It improves the way your brain works, the amount of oxygen that your brain gets, and that helps to improve and regulate the way your brain functions. But there are many other home remedies as well. Massaging walnut oil into the hair helps as well. And there's some Ayurvedic herbs apart from chamomile and valerian that can help, like ashwagandha. In fact, the botanical name of ashwagandha is Withania somnifera. Somnifera means sleep-inducing. And now some people like to debate this, but clinically it's what I've seen with many patients, including myself. I used to use ashwagandha when I did weightlifting, and it used to knock me out. So there are many other things as well that can help you with this. And here's the thing, if you are watching this and you know a couple of home remedies that work for you, feel free to share it in the comments. Let other people know. As long as they're safe, feel free to share it. And if you would like to get in touch with me, you can do so through my website, drnishal.com. I do online video call consultations. So no matter where you are in the world, we can get in touch. And I'll see you in the next video.